Go.
Have you ever gotten an extraction and forgot how to take care of it once you left the dental office?
No, I'm only 11.
Or are you thinking of getting your wisdom teeth removed once you get a little older?
Yes.
Maybe. Yes. And you want to know how to care for it, your recovery time, what to eat, what not to eat, what to stay away from. Well, today I would like to tell you a bit about post-operative care after tooth extractions. This could be a little helpful and a little simple guide to help you get through the process. In 2020, the National Library of Medicine conducted a study which has shown that proper communication and education can help reduce the risk of infections and improve patients' at-home care. We will be going over your do's and your don'ts, your hygiene, and your diet for the days to follow after surgery. Restrictions and limitations. Moisturized gauze. So once we get done with the extraction, we'll place a moisturized gauze in the extraction sites. Now this is supposed to help with your healing process. Once the bleeding stops, it'll cause you to have a dry socket in the extraction area. So make sure you moisturize the gauze. School of Dentistry at the University of Washington stated if stitches are placed, don't mess with them with your tongue. Dislodged sites can cause dry sockets. No spitting because it can cause you to make a vacuum motion with your mouth and it can pull the blood out. Ice pack to reduce swelling. You want to use the ice pack 2 to 3 days after your extraction site. And you want to do this 15 minutes on and 15 minutes off. Resting 1 to 3 days is recommended after you get surgery done. Medication and antibiotics may need to be taken with food to prevent nausea and vomiting. Keeping a stable diet is essential for recovery. Dentally.org suggested staying away from hot foods and suggests soft foods are best to eat, such as bananas. Ice cream is good. Anything cold will help with swelling. Oatmeal, eggs, anything soft. The colder the better. Don't use any lime or any spicy foods because it can irritate the site. You can drink plenty of fluids, just no straws. Straws also cause you to make vacuum motions with your mouth and you can dislodge the blood clot. Fluids, you can have water, salt water, you can have tea, Gatorade, juice. You don't want to smoke because the smoke will cause your socket to dry out. And it can cause underlying nerves in the extraction site to become exposed and it can cause pain. Dental.washington.edu suggested days after surgery you can eat foods that don't require a lot of chewing. Until the gums fully close and the hole is no longer visible, it is important to keep the site clean, and it is important to keep any foods away from the site. So hygiene is very important. City MedlinePlus.gov stated to help fight the risk of infections, rinse with warm salt water 2 to 3 times daily, 24 hours after your extraction site. So when you leave the office, we'll typically give you saline water. And it's just like salt water. You can make your own salt water at home. Just a tablespoon of salt and with some water and just kind of swish around. It helps alleviate pain. It'll also help you with your healing process. You want to stay away from any oral mouth rinses like Listerine, just because it can cause you burning, irritation to the site. So just use the mouthwash that the doctor's going to recommend for you to use. They may prescribe you chlorhexidine or Paradex along with your antibiotics to help fight infections. You do want to brush gently. However, if you have sutures that were placed, you don't want to brush your sutures. You want to stay away from them because the bristles can accidentally tug and pull at them, and it can cause them to open your extraction site again. So just brush very gently around the extraction area. Try to keep it as clean as possible. And keep clean of any debris around the extraction site. In hindsight, post-operative care is important to maintain in order to reduce the risk of infections. Do's and don'ts help keep a steady pace for recovery, and it is important for the first 3 to 5 days. Keeping a soft diet helps keep you strong, while fighting infections along with your antibiotics and the medications that the doctor prescribes you. Hygiene is best to keep clean and so that bacteria does not turn into infections. If this topic interests you and you're up next for your appointment, I suggest doing a little research to keep you on top. Above all else, follow the guidelines provided to you by your dentist. In case of an emergency, do not hesitate to call 911. Thank you.